Okay, okay na. Okay. So, good morning, everyone. For today, together with Ms. Charlene Rivera, we will be reporting about the benign and malignant neoplasms of salivary glands. For the benign neoplasm, it will be discussed by Ms. Charlene Rivera.
So, next slide, please. So, first, we will be discussing the salivary gland anatomy. So, yung salivary gland, may two paired siya. Sa major, merong parotid, submandibular, and sublingual. While in the minor salivary gland, it consists of multiple submucosal upper aerodigestive tract, which from nasal cavity and lips down to the esophagus and trachea. Next slide, please. Yan. So here is a representation of benign salivary gland tumor versus the malignant salivary gland tumor. So kapag benign, it is slow growing, soft or rubbery consistency, and 85% of parotid tumors are benign. They do not ulcerate and they do not associated with nerve signs. While in the malignant salivary gland tumors, it is sometimes fast growing, sometimes hard consistency. Next will be the 45% of minor glands are malignant, and it may be ulcerate and invade in bone. And aside from that, it may cause canal nerve passes, which affects the parotid tumor, causes facial palsy such as cerebral Bell's palsy. Then adenoid cystic carcinoma can cause multiple nerve lesions, especially of lingual, facial, or hypoglossal nerves. Next slide, please. So, back ulit. Yung sa benign neoplasm. Yan. So, benign neoplasms. So, benign neoplasms look like a lot of tissue with normal cells, which it originated as a slow growth rate. Benign neoplasms do not invade surrounding tissues and they do not metastasize. Thus, the characteristics of benign neoplasm include slow growth, resemblance to tissue of origin, which is well differentiated, circumscription, lack of invasion, and absence of metastasis, as I've said a while ago. Next slide, please. So, mixed tumor or pleomorphic adenoma. So, what is pleomorphic? It means able to alter their shape and size. Adenoma means it started from epithelial tissue, which covers our organs and glands such as the salivary glands. So, the mixed tumor or the pleomorphic adenoma is the most common in salivary gland. It is also known as benign mixed tumors or BMTs because of its dual origin from epithelial and myoepithelial elements. So, yung etiology niya ay unknown. So, aside from that, it is constituting up to 2/3 of all salivary glands. Kaya tinatawag na common yung tumor na to sa parotid. Next slide, please. So, yan, yung clinical features niya. Again, it is the most common tumor of the salivary glands. So, nireport ni Enerot na common site ang parotid glands because of 90% of group of these tumors consisting 1,900 tumors ang nagkakaroon ng case ng pleomorphic adenoma. Here is a representation of a normal palate. Ang katabi nito is yung palate na may pleomorphic adenoma tapos tinanggal na yung pleomorphic. Ayan yung example. So, next slide. So, ito, same lang naman siya doon sa nauna. Binigyan lang natin ng emphasis yung common siya sa na salivary gland tumor. Okay. Next slide. So, yung histologic features niya, according to Foot and Francel, it will be categorized into following types, such as principally myxoid and cellular components present in equal proportion, predominantly cellular, extremely cellular. So, ito, sa right side picture, showing the keratinizing epithelium in a background of plasmacytoid myoepithelial cells. Yan ang isang example na histologic features ng pleomorphic adenoma. So ito, dito makikita yung naka-circle na part, yan yung na-damage na pleomorphic adenoma. So next slide, please. So, for the treatment and prognosis, so ang accepted na treatment nito is surgical excision. More on surgical excision lahat ng benign neoplasms. Other than that, wala nang ibang treatment doon. So, etong treatment na to, sa tumor na to, hindi ina-advise yung radiotherapy because of medyo maliit lang yung benefit niya, hindi talaga nakakatulong and madaming contraindication. And etong tumor na to is pwedeng mag-arise into carcinoma. Okay, next slide please. So next would be the basal cell adenoma. So what is a basal cell adenoma? It is a neoplasm of a uniform population of basaloid epithelial cells arranged in solid, trabecular, tubular, or membranous patterns. So ang etiology nito is unknown din. It can be associated with Brooks-Spiegler syndrome or the multiple familial trichoepithelioma caused by CYLB mutations. So, ano ba yung mga clinical features nito? So, yung basal cell adenoma occur in major salivary glands, particularly in the parotid gland. Series shows, and as reported by Batsakis, 48 out of 50 tumors were in the parotid gland and 2 were in the submaxillary gland. So it is usually painless and characterized by slow growth. It appears as a firm swelling, can be cystic and compressible. Clinically indistinguishable from mixed tumors and their greater dimension, usually less than 3 centimeters ang laki. Next slide. Ayan, as you can see, on the, ayan, yung sa mucobuccal fold dito. Ito sa left side healthy, while on the right side, meron siyang basal cell adenoma. Ito yung swelling na nakikita natin. Next slide, please. So, microscopic pictures. Yung microscopic pictures ng basal cell adenoma, it is fairly uniform and regular with 2 morphologic forms can be seen. So one cell, small cell can be with a scanty cytoplasm and round deeply basophilic nucleus. Other than that is a large with eosinophilic cytoplasm and an ovoid pale staining nucleus. So, pwede siyang i-divide into 4 subtypes such as solid, tubular, trabecular, and membranous. Next slide, please. Here is a table of what I am discussing, the subtypes, the solid type, as you can see. It is the most common type of the basal cell adenoma. It is the solid variant. So the basaloid cells from islands and cords that have a broad, rounded, lobular pattern. Cells, such of the cells are sharply demarcated from the connective tissue stroma by basement membrane. So may feature din siya ng melting type of growth characteristic of pleomorphic adenoma. Associated to meaning, associated din siya sa pleomorphic adenoma, yung basal cell adenoma. So second is the tubular type. So this pattern exhibits small, round duct-like structures. These tubules, ayan, lined by distinct layers with inner cuboidal ductal cells. Ayan, kikita natin na may cuboidal dyan sa mga sa histological patterns ng basal cell adenoma. The tubular variant is the least common, pinaka-least common siya sa subtypes ng basal cell adenoma. So, however, this tubule formation either alone or with basal cell masses. It can be found in the most basal cell adenomas, at least focally. So next is the trabecular type. This subtype has the same cytologic features as the solid type. Halos magka-same lang sila. Pero meron itong epithelial cells, narrower siya, and cord-like are interconnected with one another. It produces a reticular pattern. So, pang-apat is the membranous type. So, what are these membranous type? This is a distinct subtype of basal cell adenoma characterized by the presence of abundant, thick, eosinophilic hyaline layer that surrounds and separates the epithelial islands. So, these epithelial islands are arranged in large lobules and appear to mold to the shapes of other lobules to resemble a jigsaw puzzle pattern. So, totoo naman kasi parang mukha siyang jigsaw puzzle pattern tong membranous type. Again, the solid type is the most common. Yung tubular type is yung least common. Yung trabecular type is same, magkapare sila ng solid type, which produces reticular pattern. Then fourth would be a view of a resemblance of jigsaw puzzle pattern. Next. So ang treatment, again, it is treated by excision and recurrences are seldom seen. Pag tinanggal yung tumor, possible na hindi na bumalik yung tumor, pero kapag hindi na-regulate, syempre babalik yung tumor na yun. Okay. Next slide. So next would be the canalicular adenoma. So this canalicular adenoma is an uncommon neoplasm. It is composed by columnar epithelial cells arranged in a single or double layer forming branching cords in a loose stroma. The bilayer shows an intermittent separation which forms structures resembling lumen or canaliculi. So, ano yung clinical features nito? So, excuse me. So, yung lesion nito is nag-originates primarily in the intraoral accessory salivary glands. And in the vast major cases, it occurs on the upper lip. So, cases shows that the lesion occurred in the palate, buccal mucosa, and lower lip. It was noted by the examination of the parotid gland by Nelson and Jacobe. So, it occurs in adults, far more common in patient ages 34 to 65 years old. Ito yung nakikita most commonly in females. So, may ratio ito na 1.8 by 1. So, next is the tumor generally represents a slow-growing, well-circumscribed, firm nodule, particularly in the lip, and it is not fixed, and it can be moved through the tissues for some distance. So occasionally, Two separate and distinct tumors may occur in the upper lip of an individual. So, next slide, please. Yan. Again, dito na naman siya sa mucobuccal fold. Sa taas ng mucobuccal fold, more on the upper, sa loob ng upper lip. Ayan. Canalicular adenoma. So, sa left side, pinapakita yung normal mucobuccal fold and gingiva. And then sa right side, pinapakita na mayroong canalicular adenoma. Next slide, please. So, yung histological features nito, this have a long column or cords of cuboidal or columnar cells in a single layer. The single layers are parallel, forming long canals. Ayan, as you can see in the first picture, para siyang may kanal. Meron siyang nagpo-form ng long canal. Sometimes, row of cells are closely approximated and appear as a double row of cells showing a party wall. The cystic spaces are usually filled with an eosinophilic coagulum. So, yung nasa baba, ganun naman ang kinakalabasan, yung eosinophilic coagulum. Parang namumuo yung eosinophils. The supporting stroma is loose and fibrillar with delicate vascularity. Ayan, yung sa lower right. So, ayan, representation of tumor single rows of cells that are arranged in parallel lines which form long lumina that have a canalicular appearance. Ayan. So, for the treatment and prognosis, again, it can be surgically excised or by enucleation. So, again, recurrence is rare. Yung pagbalik ng sakit, rare talaga yon unless lumala. And magpro-progress siya into malignant tumors. Next slide, please. Next would be the myoepithelioma. So, this myoepithelioma are uncommon salivary gland tumor which accounts for less than 1% of all major and minor salivary tumors. Nonetheless, it is important in the component cells constitute a prominent place in salivary gland neoplasia. Yung etiology niya is unknown. So, ang clinical features niya is there is no clinical features which can serve to separate the myoepithelioma to the more common pleomorphic adenoma. Yung mga adenoma na to na benign is associated talaga siya dun sa pleomorphic adenoma. So it occurs in adults with an equal gender distribution, meaning walang pinipiling gender to, mapababae or mapalalaki, nagkakaroon ng myoepithelioma. So the parotid gland is the most commonly involved, and aside from that, the palate is the most frequent intraoral site of occurrence. So according to Scuba and Brannon, it is reported that nagkaroon din ng lesions in the retromolar glands and in the upper lip. Next slide, please. Ayan. Yan yung representation ng clinical features ng myoepithelioma. So, sa left, again, normal yung palate. Then, sa right, yung palate na may myoepithelioma. May makikita na kayong solitary swelling. Ayan. This picture presented a palate with myoepithelioma. Next slide, please. So, ano ba yung histological features ng myoepithelioma? So, yung myoepithelioma is composed of exclusively or almost exclusively form of neoplastic myoepithelial cells. These neoplastic cells are predominantly spindle-shaped or plasmacytoid. So, aside from that, it is often difficult to diagnose definitely at the light microscopic level. The myoepithelioma does not contain the characteristic chondromyxoid stroma or of the pleomorphic adenoma kasi ang sinasabi nga dito ay ang shape niya is spindle shape or plasmacytoid. So aside from that is yung spindle shape tends to be more cellular than the tumor consisting of predominantly plasmacytoid cells. So mas makikita yung spindle cells more kesa dun sa plasmacytoid cells. So in here, we can see that the cells are present in groups separated by a loose myxoid stroma. Ayan. Yan yung picture ng histological pictures ng myoepithelioma. Aside from that, desmosomes are encountered between adjacent cells. So, meron ding desmosomes din sila. So, again, for the treatment and prognosis, so ang treatment nito is it can be surgically excised or excision, surgical excision. The same applies on all the benign neoplasms. Next slide, please. So this is the oncocytic tumors or oncocytoma. It is a benign, rare tumor composed of oncocytes with granular eosinophilic cytoplasm with a large number of atypical mitochondria, except that it is not certainly attain any great size. It does not differ in its clinical characteristic from other benign salivary glands. So, for this reason, a clinical diagnosis is difficult, if not impossible to establish. Parang same siya sa myoepithelioma, mahirap siyang i-diagnose. The name oncocytoma is derived from the resemblance of these tumors to apparently normal cells which have been termed as oncocytes and which are found in a great number of locations such as the salivary glands, respiratory tract, breast, thyroid, pancreas, parathyroid, pituitary, testicle, fallopian tube, liver, and stomach. These cells are predominantly seen in duct linings of glands in elderly persons or patients, but little is actually known of their mode of development or significance. So, pag makikita natin na sa microscopic in an electronic microscopic pinapakita na yung cytoplasm of the oncocyte is choked with mitochondria. Ionizing radiation is the predisposing condition. So, yung oncocytic tumors or oncocytoma is affected by ionizing radiation. Yun. Possible na ang ionizing radiation ang nagkakos ng oncocytic tumors. Next slide, please. So, ang clinical features nito, it is somewhat common, more common in women than in men. According to Chaudhry and Gorlin, nangyayari ito exclusively in elderly patients or persons. A review literature found that 29 cases of oncocytoma and added 4 new cases reported. So occasionally, this tumor arises from the age of 60 years and 80% of cases occurring between ages 51 to 80 years. So this tumor measures about 3 to 5 cm in diameter and appears to be discrete encapsulated mass, which is sometimes nodular. The pain is generally absent, meaning manhid na, wala nang pakiramdam pagka nagkaroon na ng oncocytoma. So, an interesting condition called diffuse multinodular oncocytoma or oncocytosis of the parotid gland has been described by Schwartz and Feldman. In this condition, it is characterized by nodules of oncocytes which involve the entire gland or large portion of it. Next slide, please. So in here, as we can see that the left side have a normal retromolar pad. So the right side shows the oncocytoma wherein ayun sa retromolar pad nagkaroon ng swelling because of the ionizing radiation, and it results into oncocytoma. Next slide, please. So, ang histological features ng oncocytoma or oncocytoma tumors. So, the oxyphilic adenoma is characterized microscopically by large cells with an eosinophilic cytoplasm and distinct cell membrane, which tend to be arranged in narrow rows or cords. So, these oncocytes are arranged in sheets or nests and cords. Mukha siyang pugad and may mga cords, which forms an alveolar or organelle pattern. In some degree, cellular atypia, nuclear hyperchromatism, and pleomorphism is accepted as compatible with benignancy in oncocytoma. These cells exhibiting few mitotic features which are closely packed and there is little supportive stroma. In the lymphoid tissue, it is frequently present but does not appear to be an integral part of the lesion. According to Kai and Still, ultrastructural studies of parotid oncocytomas have shown that the cells are engorged with an enlarged and more morphologically altered mitochondria. A variant of oxyphilic adenoma is sometimes seen in the intraoral salivary glands, particularly the buccal mucosa and upper lip. Aside from that, there may be marked clear cell change, and these tumors may be referred to as the clear cell oncocytoma. Dito pa lang parang 'di ba? Dito pa lang nagsisimula yung parang progression. Magpo-progress pa lang siya kapag hindi naagapan into clear cell oncocytoma. Kasi pag hindi siya naagapan, magpo-progress siya into malignant tumor. At gaya nga ng sabi ko kanina, kapag hindi na treat agad, magpo-progress siya into a more serious diseases such as malignant tumors, or ito is the oncocytoma can happen or can happen onto the or can be resulted into clear cell oncocytoma. Next slide, please. Ayan yung histological features. So in picture A, normal oncocytes in accessory salivary glands of elderly patient. B, high power micro photograph. Then C is for the low power photomicrograph of oncocytoma. May oncocytoma na. Next slide. So for the treatment, again, it is the treatment of choice is surgical excision. But this tumor does not tend to recur. Hindi na siya bumabalik once na natanggal. Malignant transformation is uncommon, but malignant oncocytoma is now a well-established entity. Diba? Sabi nga kanina, pwedeng mag-progress into clear cell malignant tumor, yung oncocytoma. Next slide, please. Next would be the sebaceous adenoma. So it is a rare benign tumor that accounts for 0.1 or 0.1 of all salivary gland neoplasm and slightly less than 0.5 of all salivary adenomas. Usually, ang age na tina-target nito is 58 years or nagre-range siya into 20 to 90 years old. Ang tumor na to is more common in men. Yung tumor is nagre-range ng size into 0.42 to to 3 centimeters in diameter. Yung histological features nito ay the tumors are encapsulated or sharply circumscribed. They are the color of which sebaceous adenoma can be grayish to white or pinkish to white to yellow or yellowish gray. These tumors are composed of sebaceous cell nests with minimal atypia and pleomorphism and no tendency to invade local structures. So occasionally, these tumors demonstrate marked oncocytic metaplasia and histocytes and or foreign bodies, giant cells may be focally. So again, for the treatment, conservative excision seems to be the treatment of choice. And wala pang nare-report na recurrence of sebaceous adenoma. Next slide, please. So ayan, yan yung picture showing the clinical features of sebaceous adenoma. So first, again, sa left side, normal yung palate niya. And then sa right side, meron na siyang sebaceous adenoma. Ayan, may swelling na. May swelling na sa palate. Next slide, please. So, ayan, yung histological features niya. Yung histological features niya, meron siyang pinapakitang cystic and solid growth with squamous and sebaceous differentiation. Ayan. Next slide, please. So, ductal papilloma. The ductal papilloma is used to identify a group of 3 rare benign papillary salivary tumors. So, meron siyang tatlong type, which are the inverted ductal papilloma, intraductal papilloma, and cyanodenoma papilliferum. Next slide, please. So, the inverted ductal papilloma, it is very rare tumor and has described that the only tumor happen in minor salivary glands of adults. The lower lip is the most frequently involved site, followed by the buccal vestibular mucosa. This inverted ductal papillomas appear to have arise from the excretory ducts near the mucosal surface. Yung clinical features ng inverted ductal papilloma is seen usually in the submucosal nodules, which may have a pit or indentation in the overlying surface mucosa, meaning parang may meron siyang dimple. And it do not show any gender predilection. Next would be the it consists in the histological features, it consists of basaloid and squamous cells arranged in thick bulbous papillary proliferations that project into ductal lumen. So this lumen is often narrow and in some tumors communicates with the exterior of the mucosal surface through a constricted opening. So the treatment is excision with a curative and less tumor are not reported to recurrence or pagbalik ng tumor, wala pang nare-report na bumalik ulit yung tumor sa inverted ductal papilloma. Next slide, please. Next would be the intraductal papilloma. So the intraductal papilloma is an ill-defined lesion that often is confused with papillary cystadenoma. It usually occurs in adults with the mean age of 50 years old and the common target nito is yung minor salivary glands. Yung lower lip is the most frequently involved site by upper lip, palate, and buccal mucosa. Again, there's no gender predilection. Predilection has been noted. So, ang clinical features ng intraductal papilloma is the submucosal swelling. It can appear to arise from the excretory ducts at a deeper level than the inverted ductal papilloma. Mas malalim yung tumor na ito. or yung lesion nito. Next is the microscopic features. It exhibits a unicystic dilated structure. Yung cyst wall is lined by a single or double row of cuboidal and columnar cells, which extends into the cyst lumen as papillary projection, having thin fibroblascular course. So again, the treatment for this is excision, and there is no recurrence reported. Next slide, please. Then the last will be the Sayala adenoma papilliferum. So the Sayala adenoma papilliferum is most commonly involved in the minor salivary gland. Meron tong more complex histology with a biphasic growth pattern of exophytic papillary and endophytic components. Usually, yung tumor na ito affects adults with an average age of 56 years old, and meron siyang gender predilection, which is yung male. The clinical features of this is it is a unique nearly all salivary gland neoplasm. It manifests as subsurface nodular swelling, whereas Cyaladenoma papilliferum occurs an exophytic papillary surface lesion. The clinical expression of this in most of the cases is squamous cell papilloma of the mucosa. So mukha siyang squamous cell papilloma. So ang microscopic features nito is makikita kayong exophytic and endophytic proliferation of ductal epithelium. Next is it is form of papillary projections, such as it is supported by fibroblascular course. It is covered by parakeratotic stratified squamous epithelium. The fibroblascular cores have an inflammatory cell infiltrate of lymphocytes, such as plasma cells and neutrophils. So lastly, for its microscopic feature is that multiple ductal lumina are seen, which are lined by double row or cells consisting of a luminal layer of tall columnar cells resting on a cuboidal basal layer. So for the treatment, chosen treatment, it would be surgically excised or surgical excision. So there's no report na nag-show ng recurrence o pagbalik ulit nitong lesion na ito. Next slide, please. So here is a representation of clinical features of the intraductal papilloma, inverted ductal papilloma, and Cyaladenoma papilliferum. Ayan, nakita niyo naman yung pagkakaiba nitong tatlo. Next slide, please. So, ito, yung histological features niya. So, yung sa intraductal papilloma, showing a minor salivary gland with an atrophy. Nakikita natin yan sa red na arrow. And sa yellow na arrow naman, nakikita yung large dilated duct is partly double-walled and partly double-walled. And shows a partly stratified squamous with numerous papillary funds extending into the lumen. Lumalagpas na sa lumen yung double-walled na stratified squamous, numerous papillary funds. Yan, you can see on the yellow arrow. Next would be the inverted ductal papilloma. So in here, the papillary proliferation in an inverted pattern of immature squamous or basaloid epithelium for the picture A and B. And the picture C naman, numerous intermixed mucosinous globlet cells and multicystic region. Ayan yung inverted ductal papilloma. Then lastly would be the Cyaloadenoma papilliferum. So ito, yung surface niya, makikita natin meron siyang papillary projection lined by parakeratotic, acanthotic, stratified squamous epithelium. Parang halos lahat naman sila nagde-describe ng nagpapakita ng squamous cell, stratified squamous cell epithelium. Ayan. Next po. It will be discussed by Ms. Salonga, the malignant neoplasm.
Okay, for the malignant neoplasm, it demonstrates aggressive traits and it has the ability to metastasize to distant areas and infiltrate and destroy the adjacent tissues. Once the cancer has progressed throughout the body, adverse effects linked to malignant neoplasm are typically linked to the host tumor size. The size and location of the primary malignancy, the impacts of local invasion and spread beyond the primary site, and also the effects of cancer colonizing the distant tissue sites can all have specific negative effects sa patient. Usually, the metastatic spread of the cancer is most frequently blamed for deaths caused by malignant neoplasm. But if we have to differentiate the two, yung benign tumors, again, it tends to grow slowly and it does not spread. While the malignant neoplasm naman, they grow rapidly and then invade and destroy the nervy normal tissue and then spread throughout the body. For the mucoepidermoid carcinoma, it is the most common salivary gland malignancy and it exhibits biological behaviors that ranges from relatively indolent, which is yung low grade, and then to clinically aggressive, which is yung high grade. Yung most common site niya is a parotid gland, where 60 to 90% of mucoepidermoid carcinomas are encountered. Yung lesion na to, it represents the most common malignant tumor of the salivary glands and it is the most common salivary gland malignancy for the pediatric patients. As you can see here, malignancy siya for patient na bata or nasa childhood stage. For the etiology of the mucoepidermoid carcinoma, up to this date, wala pa rin siyang established na direct causes. But there are several risk factors such as the ionizing radiation, occupations associated with an increased risk such as rubber products manufacturing, asbestos mining, plumbing, and some types of woodworking. Mucoepidermoid carcinomas are epithelial mucin-producing tumor, so it is believed to arise from reserve cells in the intralobular and interlobular segments of the salivary duct system. For the histopathology naman ng MEC is that it typically appears as a lobular infiltration of the adjacent tissue. Although they are often well circumscribed, a wide range of cell type, predominance, differentiation, and composition characterize this neoplasm. Again, it varies kung ano nga ba yung differentiation based dun sa content ng pinaka-neoplasm. So here in the first picture, makikita natin yung normal structure ng parotid gland, which is mainly composed of serous cells and produces saliva that is watery and rich with amylase and lysozyme as well as the antibodies. The abundant serous exocrine cells make up the bulk of the gland, as you can see here. And then yung acini naman, they are surrounded by contractile myoepithelial cells. Okay, again, it only contains serous acinus and ducts kasi nga parotid gland siya. And then, yung serous acinus, nagko-contain siya ng round centrally placed nuclei. And then, meron din presence of adipose tissue as well as encapsulation. For the MEC naman, the one we diagnosed with MEC, the tumor is primarily made up of three types of cells, which is intermediate epidermoid cells and mucous or we call as mucocytes then. However, the intermediate cell, which is not mucous or fully epidermoid, is often present then. Intermediate cells are thought to be capable of differentiating into mucous or epidermoid cells, while yung epidermoids naman, they only consist of ectodermal germ cells. As a result of this cellular heterogeneity, the histological composition, biological behaviors, and then yung clinical course ng MEC, as I told earlier, nag-iiba-iba pa rin siya. This neoplasm can also exhibit nuclear atypia, solid and cystic growth pattern. Okay, so ito naman yung tatlong grade niya which nagdi-differentiate ng MPC. For the low grade, we can see yung intracystic spaces. Malalaki yung spaces niya and then they are composed of cuboidal to columnar mucus-secreting cells arranged around microcystic structures with an intermingling intermediate cells with few epidermoid cells. For the intermediate grade naman, we can see that there is a presence of hyperchromatic nuclei and microcystic spaces, while for the high grade naman, makikita natin na merong focal necrosis dun sa may pinaka-arrow. Ayan, focal necrosis siya. And then they are also characterized by neoplastic cell clusters composed chiefly by epidermoid cells that are more solid with fewer mucin-containing cystic spaces and scattered mucuses. So again, sa high-grade focal necrosis, and then mas solid na yung epidermoid cells nila. For the clinical manifestation, yung low grade, tumors of low grade kasi they have prolonged period of painless enlargement. Again, there is no pain, but it resembles as an extravasation or retention type mucocele that at times may be fluctuant as a result of mucus cyst formation. For the high grade naman, it grows rapidly and are often accompanied by pain and mucosal ulceration. Ito namang high grade, meron naman siyang presence ng pain na. And also, it is obstructive and meron din siyang involvement of facial nerve involvement. It can also arise within the maxilla or mandible, appearing as a radiolucent lesion within the molar and premolar areas. For the treatment and prognosis, treatment of low-grade mucoepidermoid carcinoma is typically surgical, as well as the high-grade. Pero sa high-grade naman, it comes with post-operative radiotherapy sa primary site, and also neck dissection. For differential diagnosis, we have the squamous cell carcinoma of the skin, squamous cell carcinoma of the head and neck, adenosquamous carcinoma, and then pleomorphic adenoma. For the polymorphous low-grade adenocarcinoma, it was first reported in 1983 by two different groups using the terms lobular carcinoma of the salivary gland and then terminal duct carcinoma. For this tumor, generally, it is considered to be low-grade, basing its name, low-grade siya. And then, it is with a indolent course and lower risk of recurrence and metastasis compared to adenoid cystic carcinoma. For the common site naman, makikita siya usually sa minor salivary glands and then sa palate. Next is the etiology. It is believed to be the reserve cells in the most proximal portion of the salivary duct. Myoepithelial differentiated cells appear in this neoplasm, but only in low to moderate numbers. For the histopathology, absence of encapsulation together with infiltrating streams of cells and a general lobular morphology characterize this group of low-grade adenocarcinoma. And in most areas, the tumor are composed of homogeneous population of cells with prominent bland, uniform, and often vesicular nuclei surrounded of a minimal cytoplasm. Well, for the nucleus naman, as you can see here in the picture, it exhibits as ovoid, small, and meron ding presence ng powdery chromatin, and there is an indistinct cell borders, basing it sa histologic features ng nasa picture. Here we have the three patterns ng polymorphous low-grade adenocarcinoma, which is in streaming, pseudocribiform, and then solid jigsaw pattern. These cells kasi they are arranged in lobules as well as solidness. And then yung cribiform structure naman, they are there is a resemblance to adenoid cystic carcinoma. So sa adenoid cystic carcinoma, makikita din yung gantong features. And then yung tumor cells naman nila, usually spindled siya and arranged intrabecularly and narrow ports. While nuclear atypia, necrosis, mitotic figures naman hindi siya usually present sa polymorphous low-grade adenocarcinoma. But yung stroma niya, it contains mucoid quality and hyalinization. Okay, for the clinical manifestation, it occurs in the 5th through 8 decades of life with no gender predilection. Again, wala siyang gender na pinipili, pareho lang yung taas kung sino nakakakuha nito. So it accounts for 26% of all salivary carcinoma and more than 70% occurs in the patient between ages 50 to 70 with the mean age of 59 years old. So it presents as firm, elevated, non-ulcerated, nodular swellings that are usually non-tender. As we can see here in the picture, ganun yung clinical manifestation niya and yung features niya. Well, sa second picture naman, makikita natin na meron na siyang na-excise na siya or nag-undergo na yung patient sa surgical excision, which is the treatment for the polymorphous low-grade adenocarcinoma. For differential diagnosis, we have the adenoid cystic carcinoma, pleomorphic adenoma, and cribriform adenocarcinoma if one considered it as a separate diagnosis. For the adenoid cystic carcinoma naman, or the ACC, it is a rare malignant tumor of the salivary gland with higher frequency in the submandibular gland. It is a prolonged clinical course and poor long-term survival. It tends to metastasize to the lungs, bone, liver, brain, and rarely to the skin. Sa ibang patient, yung ACC pwede siyang mag-metastasize along the voice box or yung larynx, which lies between the throat and then the trachea. So, ang nangyayari dito, if yung tumor na to nag-appear along that area, yung tumor growth na yan, pwede mag-result siya ng difficulty in breathing upon exertion, and then shortness of breath, and eventual airway obstruction na dapat nating iwasan. Okay? For the etiology naman, adenoid cystic carcinoma still has an unclear specific etiology, but current research, however, points genetic alteration or the mutation as a fundamental cause of cellular malignancy in many malignancies. So researchers speculate that yung protein such as the MYB, NFIB plays a role in the development of ACC tumors or the adenocystic carcinoma. Also, yung mutation din ng Notch1 gene are also associated with ACC, particularly in patient with recurrent or metastatic disease. So, patient na merong mutation sa Notch1 gene nila have a worse prognosis. For the histopathology naman, it is composed of duct-type epithelial cells and myoepithelial cells in variable patterns, typically showing little cellular atypia and rare mitotic figures. Ayan, siya. There are three basic histomorphologic patterns that have been identified, which is yung tubular, ito siya, yung upper, tubular yan, cribriform, and then yung solid. And then yung cribriform pattern kasi, it is usually best recognized and usually mas madala siya makikita. And prototypical one that typifies the tumor. So, yung tubular naman, composed naman siya ng smaller island of cells with distinct duct-like structure. Ayun nga, as I said earlier, yung tubular, itong nasa upper and lower ng first picture, yan yung tubular, and it shows para siyang island of cells, para siyang maliliit na islands. While for the cribriform naman, mas solid siya. Ayan, yung nasa middle, yung cribriform. For the second picture naman, ito yung epithelial cells that have clear cytoplasm and poorly defined yung border niya as well as yung nuclei. For the third picture naman, it shows the immunoreactivity ng tumor cells for the cytokeratin. Ayan, another picture of cribriform pattern that shows a Swiss cheese appearance. And also, yung cribriform pattern kasi, it is composed usually by myoepithelial cells mixed with hyalinized globules, and then meron din siyang scattering of ductal elements na present. Next is for the clinical manifestation, infiltrative, slow-growing, unilobular mass that is formed on palpation. Although with occasional pain or tenderness. These lesions are generally characterized by slow grade. Pain and facial nerve weakness or paralysis may occasionally be the initial presenting symptoms, especially sa late stage ng lesion na to. A common feature of intraoral lesion, particularly those arising on the palate, is ulceration of the overlying mucosa. For the treatment and prognosis, again, surgery, tapos radiation therapy, naman may role siya sa management of primary disease, and also post-operative modality din siya para ma-prevent yung recurrence ng neoplasm. And then for the prognosis naman, patients with adenoid cystic carcinoma must be judged not in terms of 5 year survival rates, but rather in terms of 15 to 20 year survival rates. Survival rates at 5 years is approximately around 70% and at 15 years naman is around 10%. Okay, differential diagnosis, pleomorphic adenoma, especially if encapsulated, epithelial myoepithelial carcinoma, human papilloma V virus related multiphenotypic sononasal carcinoma, and then intraductal carcinoma of the salivary gland. For the clear cell carcinoma, ayan, ito clear cell carcinoma siya, pero makikita siya sa lateral side ng tongue. It is also called as hyalinizing clear cell carcinoma. It is a low-grade tumor that occurs predominantly in the minor salivary glands, which 80% of the cases, most presently as submucosal masses in the palate, although other sites may be affected. Etiology unknown, pero yung finding of clear cell tumor in a parotid gland, it involves necessity of the differential diagnosis between primary cell parotid tumors and metastasis mainly from the kidney. Histopathology, ayan. The tumor cells of the clear cell carcinoma, it exhibits clear cytoplasm. So microscopically, this neoplasm is composed of uniform bland cells predominantly with clear cytoplasm. The pattern is typically trabecular, although nests and sheets of cells may be seen. As with many translocation tumors, many areas of the lesion have a monotonous appearance. A minority of the cells can contain eosinophilic as opposed to clear cytoplasm, and as well as the cells are surrounded naman with variably hyalinized stroma. These tumor cells nagpa-positive sila for glycogen but negative naman for mucin, S100 protein, and muscle-specific actin. So again, hyalinizing clear cell carcinoma, it demonstrates consistent EWSR1 ATF1 fusion, which is similar translocation that is in clear cell odontogenic carcinoma but not found in other clear cell mimics. Again, for clinical manifestations, swelling and mass lesions. For treatment and prognosis, excision and new recurrence niya, very uncommon. So no, parang hindi masyadong ina-apply dito yung post-operative radiotherapy. And as well as for the differential diagnosis, we have the clear cell odontogenic carcinoma, clear cell variant of calcifying epithelial odontogenic tumor, clear cell renal carcinoma, epithelial myoepithelial carcinoma, mucoepidermoid carcinoma, clear cell variant, and then the sinonasal renal cell-like adenocarcinoma. For the acinic cell carcinoma, it is relatively infrequent tumor. Though identified siya as separate entities since century ago, its malignancy was potentially ascribed in 1953. This low-grade malignant tumor commonly involves the parotid gland followed by the minor salivary gland. It exhibits predilection for young age and female sex. So, pediatric patient and usually sa mga babae siya tumatama. The multidirectional differentiation of the neoplastic cells together with sparsity in morphological hallmark of serosacinal differentiation as evidence in some cases. So it poses a real diagnostic challenge. Though yung conventional acinic cell carcinoma is a low-grade tumor, pag poorly differentiated siya and high-grade, nag-transform siya into high-grade, it will exhibit a propensity for metastasis and an unpredictable malignant behavior. For the etiology, we have that it can be from the intercalated duct reserve cell, although there is a reason to believe that the acinic cell itself retains the potential for neoplastic transformation for this disease. Histopathology, it typically grows as an intraglandular mass that is generally well circumscribed. The neoplasm exhibits a solid microscopic pattern, although 1/3 of the lesion have a microcystic pattern, while the papillary and and follicular patterns may have seen with a solid component or may represent the majority of the lesion. Ayan siya. So, hemosiderin din often found sa microscopic picture niya. And also, meron ding little stromal tissues as well as yung tumor cells niya, they are uniform and well differentiated towards the serous acinar cells. Well, for ano naman, it also contains cytoplasmic PAS positive, diastase digestion resistant granules similar to those found in normal acinic cells. And to add to that, kasi they have ano din, for the acinic cell carcinoma, they demonstrate clear cell element zones that probably is caused by the inadequate fixation. Okay, for the first pictures, it shows, ito, diagnosed with ACC, it shows a finely vacuolated cytoplasm and then round nuclei and visible nucleoli. Okay. Clinical manifestation ng acinic cell carcinoma is that it presents as a slow-growing lesion smaller than 3 cm in diameter. Pain, meron din siya, kasama yung pain, and rarely acinic cell carcinoma as with other malignant salivary gland tumor, including adenoid cystic carcinoma, they may assume a differentiated phenotype with corresponding levels of clinical aggressiveness, rapid growth, and lymphovascular invasion, and regional lymph node metastasis. For treatment and prognosis, yung lesion na to, it accounts for 14% of all parotid glands tumors and 9% naman for total salivary gland carcinoma for the all sites. So, katulad lang din sa every neoplasm, usually surgery lang talaga yung preferred treatment for the acinic cell carcinoma. Differential diagnosis, we have the mammary analog secretory carcinoma, mucoepidermoid carcinoma, and myoepithelial carcinoma, and lastly, the oncocytoma. Okay, for this one, adenocarcinoma not otherwise specified. So yung term na to, it is used as a diagnosis when lesions cannot be classified into existing categories. So the not otherwise specified or NOS or NOS label indicates the microscopic appearance is non-specific. Whether the lesion can be considered of high grade depends on the presence of the cellular atypia and invasive growth pattern. Also, yung anos or yung adenocarcinoma not otherwise specified kasi it constitutes a group of salivary carcinoma with ductal or glandular differentiation that lacks sufficient histologic feature. That's why hindi sila ma-recognize for any categories na salivary gland carcinoma para magkaroon sila ng specific diagnosis. For instance, yung tumors kasi, yung tumor both with for tumor with both mucoepidermoid carcinoma and adenoid cystic carcinoma or acinic cell carcinoma as well as the cribriform carcinoma, they are all example of hybrid tumors. So there are presently no nomenclature with which adequately describes this tumor. The disparity inherent to the hybrid tumors comes from the fact that either element differentiates towards distinctly differently salivary elements. For example, yung excretory duct versus acini or excretory duct versus intercalated duct. So these are all from these are all from the archives of pathology and laboratory medicine. So, ang distinction niya is between the anus and a hybrid tumor. Yun nga. Yung hybrid tumor, it is defined as a salivary neoplasm predominantly composed of two or more disparate patterns that are not included in each other's histologic realms. So, yun lang. Yung for reference namin, ito po siya. Yun lang po. Thank you.